I just started recording. You can start anytime.
While we are stuck in our homes with not much to do, you may be wondering, what's going on outside? And what is the difference between how the 2014 Ebola outbreak was managed and how the world is managing the COVID-19 pandemic today? Welcome to Epidemiology, where we will be comparing the Ebola virus and the virus that is changing all our lives today, COVID-19, and how the world responded to them.
Beyond the facade of Guinea's lush green forests and myriad of exotic animals, lurked one of the world's most dangerous viruses, Ebola. A virus first discovered in 1976, Ebola continues to threaten those on the African continent, leading to a number of outbreaks throughout the years. Among those outbreaks, the most notable of them all lasted from 2014 to 2016. It was in one of Guinea's many rural villages that Ebola took its first victim.
Then, some years later, amidst the bustle of December 2019, in Wuhan, China, a novel virus, known now as COVID-19, silently infiltrated the lives of 44 unknowing recipients who would soon grow to be millions, disrupting the long-existing normal which the world had known. The difference in the world's response to such occurrences stems from a fundamental transmission difference between the two infectious diseases.
Ebola. So how does Ebola spread? Ebola can only spread through the direct physical contact with an infected person or animal's bodily fluids. This includes urine, saliva, sweat, feces, vomit, breast milk, and semen. Contaminated surfaces and needles may also be sources of infection. Ebola may not, however, spread through air, water, or food, making it less contagious than measles, flu, and a common cold. Symptoms of Ebola begin showing up 2 to 21 days after infection. They include high fever, headache, joint muscle pain, sore throat, weakness, stomach pain, and a lack of appetite. In severe cases, internal bleeding as well as bleeding through the ears, eyes, and nose may occur. Patients may cough or vomit up blood, have bloody diarrhea, or develop a rash. It is important to note, however, that a person can only spread Ebola if they are showing symptoms.
COVID-19. So how does COVID-19 spread so far, so fast? Unlike Ebola, COVID-19 can be much easily contracted. The human-to-human transmission aspect of this virus is very alarming, and just one mishap can lead to the infection of millions of people. The virus spreads through an infected person's respiratory droplets, which can be inhaled into the lungs or land in one's eyes, mouth, or nose. Equally important, this versatile virus can stay in the air or on other objects for hours at a time, thus increasing the risk of infection for many. Symptoms of COVID-19 include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. What's dangerous about this less deadly disease, however, is that many are asymptomatic carriers or have very mild symptoms, which means that they may be spreading the virus unaware. That explains why travel bans, social distancing, and lockdowns are so crucial to this pandemic. You never know who might be carrying the disease. Given no prior experience with this novel virus, treatment, or vaccine, the only way to stop the spread is by avoiding contact with others.
Government response. Due to these key transmission differences, the scale of the two outbreaks vary considerably. While the 2014 Ebola outbreak remained mostly in areas of West Africa, bearing only 36 cases outside of Africa, the coronavirus was spread substantially to many countries around the world. As a result, government response is quite different as well.
The World Health Organization responded to the 2014 Ebola outbreak by declaring it an international health concern in August of 2014, 5 months after its first official report, while Sierra Leone banned mass meetings and closed down schools. Then in September, 3,000 military personnel were sent by the U.S. to set up 17 treatment centers, while Sierra Leone implemented a 3-day national lockdown, where health workers went door to door to investigate and inform. COVID-19, on the other hand, was met with more stringent protocols due to its more contagious nature.
It is also important to know that modern transportation methods, among many other factors, contributed to the rapid spread of COVID-19. Presented are records of the stringency of government responses to the COVID-19 pandemic on a monthly basis, starting from January 2020. As the virus first spread throughout China, its government implemented a national lockdown, resulting in the darker shade depicted by the maps. The darker the shade, the more severe the government response. And as aforementioned, because of our modern transportation methods and high rates of international travel, the virus quickly spread to other countries, causing widespread panic and corresponding lockdowns. However, as numbers rose and the severity of the virus came to light, governments enacted stricter measures to contain the virus, leading to lighter lockdown policies. For instance, from May to June, some countries have shifted from a dark blue color to a lighter blue color, especially in parts of Africa and Europe. Lastly, this is the most up-to-date map. Countries that have not yet updated their responses are indicated in gray.
Despite their differences, what pandemics like these teach us is the importance of collaborating as a human race to fight against a common enemy, the virus. Effective communication, decisive leadership, and quick unified responses are all crucial to the control of such crises. But more importantly, what we can do as individuals matter more than it may seem. Therefore, please follow health protocols and do what you can to practice proper hygiene in order to keep both you and those around you safe.
Especially during these uncertain times, take care and thank you for listening.